Hey there! Welcome to another episode with TrustedTRT, where we talk about hormone replacement therapy and all the latest in anti-aging treatments. And I'm here today with Bailey McGee, owner of Cascades Hormone Optimization Clinic in Oregon, and he also serves Oregon and Washington area. Bailey and I are going to discuss the most frequently asked questions men ask for hormone replacement therapy or testosterone replacement therapy treatment. Hey, Bailey, how are you today?
Hey, Ann, I'm doing great. Thanks for having me back. I'm looking for.
Great. Well, let's dive in. First, let's talk about the basics. Let's cover the basics. What is TRT or testosterone replacement therapy, and how does it work?
So, testosterone replacement therapy, we use testosterone to replace a deficiency, that being testosterone. Simple as that, really. And our goal is to improve symptom. So, our goal is symptom improvement overall. And of course, we look at labs, initial labs, and then as therapy goes on. But it's important to know that labs are just a guideline. We're not beholden to labs. What we're really trying to achieve is symptom improvement, quality of life improvements, and long-term health.
Okay, great. So let's talk about those symptoms. Like, what symptoms are men trying to improve? Like, what do they complain about? I know that in the last video we talked about younger men are seeing you more and more versus older men. Is there a difference in symptoms that they complain about?
Yes. Oh, symptoms of a deficiency, they're really broad. I like to categorize them though in physical, psychological, and sexual health symptoms. So physical, this can be, reduction of muscle mass, poor exercise recovery, loss of strength. And then if you were to measure it objectively, you could probably see bone demineralization, muscle wasting, things like this. This happens kind of later in life. And now psychological symptoms. This looks like maybe anxiety, depression, foggy headedness, inattentiveness, undecisive, poor energy, poor mood, irritable, and a lot of kind of why men come to see me is those psychological categories. And like we mentioned last time, people associate testosterone more with muscle and the physical, and that's absolutely true. But a lot of times, men are seeking help with those psychological problems, and they might be really opposed to conventional medicine, where they're going to give you an SSRI, antidepressant, anti-anxiety medicine. And now to go back to the sexual health symptoms, typically that looks like either loss of libido or drive for sexual intimacy, and then additionally, there can be some erectile dysfunction. You mentioned what young men might come to see me for versus older men. The young men definitely fall into the category of psychological symptoms. So these guys, they just don't have a drive, or they're losing interest in life. And you're at a young age. This is when you should be really pursuing what you want to do. And these guys are really struggling, and they seek out help at conventional medicine, and they just don't get an answer that they want. And then we can, check blood work, get a good subjective history, and we can measure objectively that this young man, has low testosterone levels.
Okay, so for young men, you in the last video you talked about how more and more younger men are or younger and younger men are experiencing symptoms or actually have lower testosterone levels. Do you know why that is? Why are younger men or more and more younger men experiencing lower testosterone levels?
Big question, and I think it's still largely theorized, but as time goes by, I think it's becoming proven more and more valid, and that is the topic of endocrine disrupting chemicals. And I'm very interested in this, but it's hard to. I just don't have the understanding completely, and I don't know if really anyone does. But what you're looking at here is like phthalates, BPA, pesticides. Let's see what else. Those are kind of the big ones that come right to my mind right away. But we're exposed to these things even in utero. And so it's ubiquitous, it's everywhere. Think how much stuff is in plastic, any sort of like scent and cologne and all the stuff, personal products. All of that stuff is contaminated to one degree or another with some of these endocrine disrupting chemicals. Those can be absorbed into the skin and then into the system. And then that's going to have consequences, specifically hormonally, which then has knock-on effects down the line. But I think that's kind of the best working theory of maybe why you're seeing younger and younger men have it. And then also just lifestyle factors. If a guy doesn't have drive to do stuff and he's, I don't know, playing video games all day, he's inside, he might be depressed for multiple reasons. And then society might just have kind of a negative opinion on masculinity these days, unfortunately. And that probably builds into it as well. And then on top of that, social media exposure, comparison, things like this.
I heard a rumor that I don't know if this is a rumor or you find this, but do younger men or do you find that like athletes or professional athletes or people that exert a lot of, I don't know if it's possible to exert a lot of testosterone, or the mechanics of that, but do you find that athletes kind of use up their testosterone on the field, so to speak, or is that a myth?
I don't think so. It's not like a fuel tank. It's not like energy metabolism where you're, utilizing nutrients to create energy. It's not a tank that's being depleted. That's a good question, though. I haven't really thought about it that much. But no, I think
Okay.
testosterone just has many effects. And as far as like athletes, if you're an outlier and you're a great athlete and maybe you have excellent testosterone levels, not that that makes you a great athlete, but those individuals who have higher testosterone, they're just in a like a physiologic environment where they can, you know, probably play at a higher intensity, they can train harder, and so that's just going to lead to better performance, more muscle mass, faster, more explosive, things like that.
So, does weight have any bearing, or weight or diet, or you said lifestyle factors? Does that have an impact, metabolic syndrome?
Yeah, specifically about younger men or just as we age.
I'd say younger men. If a younger man is like maybe overweight and is experiencing these symptoms, could that kind of play a role with lowering his testosterone levels?
Yeah, absolutely. I think we have a lot of evidence of that, anyways. But if let's say a younger man has excessive adipose tissue or fat mass itself is not inactive. It's actually hormonally active. And specifically, what I'm talking about is it can aromatize whatever testosterone they do have into estradiol more readily. But there's a lot of nuance here because remember, estradiol is beneficial, but estrogens in general excessively can cause some problems. And so, simply put, in an excess estrogen environment, um, you can lose the signaling from the brain to the testes, so to speak. And so obviously that's going to limit testicular function, whether that be sperm production or testosterone production. That's another thing that is becoming more and more of a hot topic is decreasing sperm counts in younger men. And once again, that's probably multiple variables, but one of them could be excess adipose tissue. These teenagers that are kind of obese, or even younger kids that are obese too, it's setting them up for kind of an unhealthy life. Some complexities with it's called uh, secondary hypogonadism due to excess obesity. So I think it's called MOSH syndrome. And I'd have to review it again, but not only do you have excess estrogen burden, but also you have signaling that is inappropriate, which can also have knock-on effects to lower testosterone.
Okay, you had mentioned sitting around and playing video games, so that leads to obesity, and I'm
Maybe not.
sure it's a cycle because if your testosterone is low, that makes you feel like tired, less drive, and so it's harder to go to the gym. It's harder to take a walk even around the block or do anything. So I can see how that's kind of a cycle. It's a cycle that's kind of tough to get out of. So if I'm a man, whether I'm older or younger, how do I know that I should check my testosterone levels? Should I see a mental health professional first, or should I get my testosterone checked first? I think with older men, it's kind of a little clearer because we all just naturally drop hormone levels as we age. But if you're like, let's say in your late 30s or early 40s, or even if you're an older male, like how should you know to get your testosterone levels checked versus ruling out other things?
Good question. So, like, if you're having any of those symptoms I mentioned previously, those physical, psychological, sexual health symptoms. And we'll just take the example of kind of like a middle-aged man, say he's and upwards. At that point, if you're kind of checking all those boxes of symptoms, it's I think it's prudent to get your testosterone checked. And you're right, testosterone doesn't fix everything, and deficiency doesn't cause everything. And so, if you rule out other causes, it's reasonable to get your testosterone checked to make sure that is not the root cause. A lot of times though, like you mentioned, as we age, cells senesce, they don't function like they once did. They become dysfunctional. And so it's completely normal for testosterone levels to drop as a man ages. But if he wants to make that conscious decision to improve his day-to-day quality of life and mitigate future risk of disease, he can make that decision to optimize, replace his testosterone.
Okay, you said mitigate future risk of disease. How does testosterone do that?
Primarily, I'm thinking about non-communicable diseases, so things that are not contagious, but that's diseases of aging, such as metabolic disease, cardiovascular disease, sarcopenia, which is muscle wasting, osteopenia, which is bone density, demineralization, insulin resistance, which kind of feeds into metabolic disease, dyslipidemia, things like this, excess body fat. So what I just kind of described there is the picture of metabolic syndrome, which if you look out into the American population, you can see a lot of that happening. Simply put, what that looks like is increasing visceral adiposity, so a wider waist circumference, scrawny limbs, perhaps. But what's going on metabolically is insulin resistance, potentially fatty liver infiltration, visceral fat accumulation, dyslipidemia, hypertension, things like this. And so by replacing testosterone, you can definitely mitigate that risk. And in addition to testosterone replacement, if you are training intensely with aerobic training, resistance training, and you start eating a whole foods diet, you're going to mitigate all those things. So with weight loss and muscle gain, your all cause mortality is going down. And so that's what I mean by diseases of aging. So we can really potentially reduce that pretty drastically, which is good news.
Okay, what are the risks of getting on testosterone replacement therapy?
The risk, honestly, not many if you do it right. Kind of like the most common negative side effects you hear about would be acne or maybe some like edema in your legs. Those are just kind of negative side effects. Not everyone gets them. And we can talk a little bit more in depth about why you get that edema in your legs potentially. But those are the kind of the two big ones that I hear more often than anything. Because like I said, it improves psychology, improves body composition and physical symptoms over time. It improves sexual health. So
O-
overall, it's really low risk because all we're doing is replacing a bioidentical hormone.
Okay, and do those side effects go away, or is there any way to get rid of those or help reduce those side effects? Like edema, you mean like swelling in the legs and ankles, or
Yeah, so edema that is thought to be caused by the transient increase in aldosterone and antidiuretic hormone, both of which reabsorb sodium, therefore water in the kidneys. And so it's not uncommon. And sorry, the reason why you become a little bit more sensitive to those aldosterone and antidiuretic hormone, it's thought to be because of the rising estradiol levels, which once again, there's nuance, and estradiol is good, but in the short term, this transient period, normally it's kind of like between 2 to 8 weeks, maybe, you have this transient kind of water accumulation, but that normalizes, the body acclimates over time and it flushes out, so to speak. But yeah, that's kind of in that first little window. But yeah, there's no need to intervene, honestly. Um, and some people get in trouble because they jump on like an aromatase inhibitor because they get a little puffy around their ankles without a plan of ever coming off of it. Uh, And once
okay,
again,
what's an aromatase inhibitor? Give us some drug names or something that we'd be familiar with.
arimidex is the one that I think about, but aromatase is an enzyme inside cells that converts testosterone into estradiol. And so, just like the name implies, aromatase inhibitor, if you block aromatase, you block the conversion of testosterone to estradiol. And so, a lot of people think that by doing this, you're going to fix the edema, and maybe you do minutely, but you're adding on increased complexity and potential harm, especially in the long term, when we expect this transient edema to just get better by itself.
Okay, so during that period, it sounds like your body's just kind of recalibrating its the hormone levels and trying to figure out what to do with the or trying to adapt and sort of go to a new homeostasis or new normal, I guess.
Yeah, I
And
like that.
if you interfere with that, then you kind of start having some problems and having to stack drug on drug. So you just have to kind of ride that out for a couple of months and go back to normal or go back to a new normal, I should say.
Yep, that's what I normally tell guys is it'll get better. Just wait a little bit. And then also, we're talking about kind of fluid accumulations. Think about it on like the female side, like during various uh, periods of their menstruation cycle. Like how females can gain a little bit of water bloat, maybe a little swelling, a little puffiness. So you're totally right. Hormones influence kind of fluid dynamics to one degree or another.
Okay, great. So how long, I know that we talked about this in the last video, but how long does it start to men start seeing results? I know they start seeing side effects after a couple of weeks, but how do you know it's working or, you're getting the right dose? Or how long can someone start seeing symptom relief or kind of walk us through the typical path of the timeline of what starts happening or what they start feeling typically in your typical patient?
It's it's individual. Kind of depends on where they start. And maybe like their baseline health anyways. But in general, I would expect some sort of for a patient or a man to notice some changes probably between 3 to 6 weeks. And typically in that time period, it happens above the neck, so to speak. So they might have improved mental clarity, better energy levels throughout the day, more decisiveness, less depression, less anxiety. Kind of just brings out some of the qualities that are masculine. So typically that's going to happen before anything. Libido improvements also tend to happen around that time. And then also, of course, there's kind of a bit of a placebo effect to one degree or another, kind of the honeymoon phase, as we call it. And then that passes, but you can still expect kind of in that 3 to 6 week initial phase that men are going to start noticing some changes. And typically it's psychological. Beyond that, physical improvements kind of start to happen at the 6-month mark. And then of course it depends if that man is actively engaging in like resistance training, aerobic training, adequate nutrition, the proper nutrition. And that guy's going to see results physically, obviously a lot quicker than the guy that is not doing that. And then you can really measure objectively body composition changes kind of at 12-month and beyond mark. And so improvements happen months to months or years to years instead of days or weeks. And so expectations need to be kind of clearly presented from the get go.
Okay, so it could be a year before you really realize the full benefits of testosterone replacement therapy.
Yeah, absolutely. At the year mark, that's when you're probably going to start really seeing like some waist circumference decrease, which is a good kind of proxy for visceral fat reduction. So the waist is going to come in a little bit. You might get obviously more muscle mass, arms, limbs. And so your appearance is going to start to look different. And then, of course, if you were to do like a DEXA scan, you could probably measure bone density, and that would be improving as well.
Sounds great. And I just wanted to ask our viewers if you like this type of content and want to get more information about the latest in men's wellness treatments, consider subscribing to this channel and support the channel by liking the video. And if there's a question that you have or clarification or a subject that you want us to cover, please write it in the comments below. We'd love to answer any questions that you have. So, Bailey, I think, online, I noticed that there's a big concern about the safety of testosterone replacement therapy. And I think that you've covered that when prescribed correctly, there actually aren't really many risks. I think there was a lot of initial concern in the past about the safety. And I think that we established here that when you're prescribed testosterone properly and monitored properly, that there aren't really any safety issues. It actually helps to extend or improve your quality of life as you age. Now, do you see in your industry where, maybe providers don't monitor effectively? And what are the potential outcomes of that? If you're not monitored properly, if you don't come in and get a checkup or get blood tests regularly and you just, get get testosterone somehow, self-injections, things like that without proper medical supervision.
Let's see. Well, so first off, if you're getting it, outside of like a legitimate pharmacy, I don't know what's in that stuff, like, you just don't know, you don't have certainty of the XYZ that's in the vial. And so obviously that can cause some harm. It's kind of like underground stuff. Potentially you could have maybe abscess development, which is like a soft tissue infection, like in the tissue itself from injecting. It's where there's bacterial infiltration, or maybe even the material in the vial itself is tainted or something. And so that can be a really serious issue, potentially bloodborne is systemic infection. So that's kind of worst case scenario. As far as like monitoring, it's really just good, healthy habit to get blood work checked, whether it be, I mean, testosterone levels, which are really dynamic anyways. And remember, we're more geared towards symptom improvement instead of chasing lab numbers. But it's good to look at lipid panels, glycemia, inflammation, blood counts, so on and so forth. And that's just good routine screening. And so, a lot of guys, so let's say the 30, 40, 50-year-old guy, it's hard to get them to go to the doctor anyways. And so you could make the argument that the more, once you're on testosterone therapy and you start getting monitored more frequently, although we expect everything to improve over time with testosterone therapy, but these guys are getting a little bit more attention and more frequent blood work so that they can maybe recognize something earlier and prevent it. Instead of a guy showing up in his mid 50s with terrible lipid panel, excessive glycemia, inflammation, so on and so forth. And so he's just increasing his risk for those diseases of aging that we mentioned earlier.
Okay. That's interesting because do you see a difference where, I mean, you probably don't know the experience of going to like an online, one of these very popular, well-known online prescription providers, the type of care that you get there versus the care that you would get with a doctor in person, whether you establish that connection through telemedicine or in your office. Do you see a difference in care? Because it sounds like are providing, yes, testosterone replacement therapy, but you're also looking after their overall health. Do you see a difference in that with some other prescription providers that offer just testosterone or, a bunch of other treatments like hair loss and things like that?
Yeah, certainly. I can, speak from my own practice, but so it's, I think we were mentioning it last time, but I'm really kind of a partner with them kind of in their health journey. And so like I enjoy chatting with my patients, get to know them. So there's a trusting relationship between us. And you're probably going to miss out on that with some of the large online clinics for sure. But now from like a clinical aspect, you're probably not going to get as detailed care either. But for me, coming from primary care, and just with a huge interest in overall health, I'm checking all those labs for you just because, one, I want you to thrive and feel your best, but also just I'm curious about other health markers. You might be missing out on that with some of the big online shops because they're very narrow focused versus me. I want to get more of a bigger picture.
Yeah, I wanted to just kind of establish that because I think there's, there's a cost to testosterone replacement therapy. Most insurance does not cover it. Maybe they might cover blood tests, or unless you're in severe need or in risk of your life, it might cover it. But for the most part, you're going to pay out of pocket something. And there might be a temptation, well, I can just save $50 a month or something. And I just wanted to talk about that, the benefits of not saving $50 a month. It's basically your life and your health, because as we get older, things start breaking down and you want somebody in your corner to catch those things before they get serious. So I think that's one of the great benefits of the extra few dollars a month that you might potentially save with one of those big box, I don't know what to call them, but those prescription providers online that are just going to make sure that you're safely getting your testosterone treatment versus looking after your overall health. So I think that's money well spent, in my opinion.
I agree. I was gonna say, yeah. So I definitely probably charge more than your online. We call them windmill clinics or clown clinics.
Okay.
So I believe that I provide superior value. You can contact our clinic, and we're going to get back to you probably in 6 to 12 hours. Any questions? We prioritize educating the patients. We don't want there to be any surprises. We want to answer all their questions up front, basically. And whenever there are questions, we're glad to answer them. Uh, because once again, we're just kind of partnering with you. We're not just trying to squeeze every dime out of you. And so, yeah, at the end of the day, I think we provide superior value, uh, convenient access to myself. It's delivery of hormones to your front door. You don't have to go to the pharmacy, and detailed lab interpretation whenever you need it.
Yeah, I think that's really important because as you said earlier, that you become sort of their first line of defense for issues that might come up and you work with them versus, as we get older, things come up. And like you said, men don't go to the don't see doctors unless they end up in the emergency room. They get dragged in there or something. So we don't want to prevent that. We want to prevent that, and we want to keep them as healthy as possible.
And that's what it's very much more proactive medicine instead of reactionary medicine. And so that's why I check all that other stuff, because yeah, the patient needs to have some sort of recognition that there's something's going wrong, whether that be metabolically or something else. If you can recognize that sooner and intervene, you're going to have a better outcome.
Yeah, definitely. So great. So we've covered the basics here today on the basic frequently asked questions. And in our next video, we're going to get into sexual health and the quality of life, some frequently asked questions around that. So stay tuned for our next video and like and subscribe, and we'll see you on the next one. I think the biggest hesitation for a lot of men to get treatment, and it's a discussion sometimes with them and their partner, and a lot of men are afraid that testosterone replacement therapy causes cancer and other diseases. What does the science say about that?
Specifically for prostate cancer, which is what most people are concerned about with testosterone. Short answer, no, it doesn't. But let me elaborate a little bit. And kind of one of the heroes in the space is a prominent urologist named Dr. Morgenthaler, Harvard urologist. But over the last maybe like 2 decades at this point, he's put out a lot of medical literature. And the conclusion is testosterone or its derivative DHT does not cause prostate cancer, nor does it exacerbate previous prostate cancer. But yeah, he's kind of the go-to regarding testosterone and prostate cancer. And once again, the conclusion is that no, it does not cause prostate cancer.
Okay. And what about heart attacks? Does it cause or exacerbate heart disease?
Actually, it's the opposite. It's shown optimal testosterone levels. Now, the outliers like abuse is something separate altogether. But if we're just talking about optimizing testosterone levels in men, testosterone is actually cardioprotective. Once again, it's a vasoactive molecule, improves nitric oxide synthesis. It actually helps with angiogenesis, so the new development of blood vessels. More technically, it increases capillary beds, therefore improving or reducing vascular resistance, which makes the workload of the heart reduced. Um, but kind of additionally, you get the metabolic improvements. So that's reduction of visceral fat mass, which reduces inflammation at large, improved insulin sensitivity, therefore reducing chronic glycemia, which can be harmful to the endothelial layer of your vasculature. And just so you know, the endothelial layer is kind of the innermost layer of your arterial system that communicates with the blood. And it is very important as far as like uh, vascular flexibility. And so the takeaway is the more nitric oxide you can have in the endothelial layer, and the less endothelial dysfunction you can have, the more dynamic and flexible your vascular system is. Therefore,
Okay.
healthier.
Okay. In English, endothelial layer is the cells that line the cardio or the heart, the cardiovascular system. Or I
Imagine like your vascular system. So arteries and veins that circulate blood everywhere. So the pipes, basically, the innermost layer is the endothelial layer. It's a single layer thick, but it is really kind of ground zero for the initial offense of like a plaque development or atherogenesis. And so whatever we can do to protect the endothelial layer is going to benefit cardiovascular health and reduce risk.
Okay, so nitric oxide
Nitric
is
oxide.
the key to keeping your heart healthy, and from what I understand.
It is the most kind of like vaso um, dynamic molecule in the body. And so it really helps vasodilate. So yeah, it's key. And then, of course, it's not always so simple. And then we can talk about how that atherogenic plaque originally develops. And it's not just LDL cholesterol, it's a combination of oxidized LDL cholesterol, inflammation, immune response, a few more steps. But the takeaway is it's not just LDL cholesterol that causes the problem.
Okay, so testosterone treatment is helps with all of that, and there's no concern that it's going to exacerbate heart disease, make things worse. It's actually beneficial.
Yeah. Additionally, you get the benefit of estradiol, like we talked about last time. And so remember, any man who's on testosterone therapy is also on estradiol therapy because estradiol is an active metabolite of testosterone.
Got it. Okay, and we're if anybody wants to learn about how to read lab results, let me know in the comments. We'll have Bailey walk us through one soon. Okay, great. So, one last question about just the basics, the fundamentals of testosterone replacement therapy. A big question I get is, how long should you be on testosterone replacement therapy? Is there a danger of being on too long? What happens if you decide to stop, or are there reasons to stop? What do you get a lot of questions about that? And how do you, uh, is there a danger of being on too long, or are you stuck on this? Or although it sounds like, why would you want to get off if you're feeling better, right?
Yeah. And you nailed it. Yeah. You probably find that most people are going to prioritize the improvement in quality of life versus like the financial cost. So not only does your quality of life improve day to day, but once again, you're mitigating those diseases of aging as well. So ideally, yeah, once you're on it, you stay on it. As long as you want to benefit from it, you stay on it. You were to stop it, you would revert back to your baseline, wherever that was. And so therefore you'd be removing a lot of the benefit. Now, is testosterone vital for survival or life? No. Food, air, water, that's vital for life. Will testosterone improve your quality of life? Yes, but it's not vital for life.
Right. Okay. So it's kind of a luxury because we're naturally supposed to have less energy. We're supposed to wind down. We're not we don't need all those sex hormones to reproduce at later ages because we're not supposed to reproduce. But so it's kind of a luxury where you just don't feel like yourself as much as, you did in your 30s and 40s. And there's just like this slow decline. So it's a choice on whether you want to feel a little better. And it's a luxury. I guess if you were to cut it out, I would kind of look at my DoorDash and Starbucks bill, and the Hulus and all of those other luxuries versus feeling better. So yeah, that's something to weigh.
Yeah, you're totally right. Now, if someone is just like absolutely objectively hypogonadal or low testosterone. I mean, like, we do know that low testosterone is associated with higher mortality, so death of any cause. And so, on one hand, yeah, like if you want to just improve health and reduce disease, it is a luxury because you do feel better, but also know that you're getting true health benefits too.
Okay.
You're, you know, 100, 200 years ago, throughout human history, I don't know what the average age span was, but it probably wasn't, 50, 60, 70, 80, 90 years old. And so it's kind of definitely a decision in modern times. If you want to improve quality of life, replace sex hormones.
Okay. So if you decide to go on testosterone replacement therapy, is it a commitment? Like, what happens if you go on it for a year and then you kind of start? Sometimes we take something, we feel better, and then we don't attribute the feeling better to the treatment. And so then we kind of get off and realize, wow, that thing really was helping me. Is there a risk to like going off and on? I'm sure it can't be healthy to have your hormone levels go up and down so dramatically over time. Is it a like you need to make a commitment to be on therapy?
Yeah, that's kind of the ideal situation is once you take part in testosterone replacement, you're committed to it. Once testosterone's optimized, then you start focusing on um, nutrition, exercise. I mean, they should all go hand in hand. But yeah, just the 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 mindset of that patient is someone who takes their health very seriously. They take responsibility for it, and they want to do whatever they can to live a high quality of life and prevent disease. Oh,
Okay.
and you mentioned, is there any risk of like coming on and off acutely? No, but once again, if you're deficient in a hormone, there could be down the line negative consequences. Once again, metabolic disease, cardiovascular health, uh, muscle density, bone density, things like. But if you just hop on and off of it, it's just probably a bad plan overall. But yeah, I don't think there's any acute harm. You're not going to die tomorrow because your testosterone is zero.
Okay, you're probably going to feel like how women feel when our hormones go up and down
Yeah,
throughout in a monthly cycle where, we kind of our mood goes up and down dramatically, but not as dramatic or not as in close in time. So you'll see those improvements and declines of improvement. So
but
yeah,
yeah,
okay.
bottom line is you want to be if you make the decision, stick with the commitment. And if you, for whatever reason, you're like, this isn't for me, it's not harmful to stop it.
Okay, that's good to know. Thank you so much for joining us. If you like videos like this, if you want to know more about anti-aging medicine and overall health, then please subscribe to our channel, like the video so that we can share it with more people and we can continue to do this. So thank you so much for joining us. Thank you, Bailey. I really appreciate your time.
Thanks, Ann. Thanks for having me.